Continuing on with the different cranial nerves, we'll pick up with the facial nerve, which is cranial nerve number 7. Now, this 7th cranial nerve, as you can see here, is going to have several different branches to it. You're going to have the temporal branch, which is this component right up here. You then have the zygomatic branch, which is what's coming off in here. Think zygomatic bone on the side of your cheek. You then have the buccal branch, which is what's coming right in here. Buccal, think cheek, so lower down. You then have the mandibular, which is this piece down here. Mandibular is going down to the mandible. And you have the cervical branch right there. Think about cervical vertebrae going down the neck. So in total, we're looking at 5 different branches of the facial nerve. Now, of these different branches, they all have their own areas, their own kind of spaces that they're actually working with. But the facial nerve is a mixed nerve. That means it's both sensory and motor. Now, the sensory aspect is taste. So when you're tasting your food, tasting what you're drinking, that taste is partially going through the facial nerve. But the rest is going to be facial expression. It's motor control. So the majority of what we're seeing here is motor control throughout the face. Looking at also secretion of tears, saliva, and different mucuses. Think oral and nasal mucus. So all these glands that are secreting in the face are being controlled by the facial nerve also. So motor output, again, remember, is not just muscle. It's anything that's causing a reaction. So in this case, the reaction here, the effector, are the glands. The glands secreting tears, the glands secreting saliva, the glands secreting the oral and nasal mucus. So this is the facial nerve, cranial nerve number 7. Next up is cranial nerve number 8, the vestibulocochlear nerve. Now, the vestibulocochlear nerve is made up of 2 nerves coming together, actually. You're going to have the vestibular nerve and the cochlear nerve. Right where they come together, that now is the vestibulocochlear nerve. So it's the 2 pieces coming together. This is a sensory nerve, so we're bringing information into the brain. Well, vestibulocochlear is coming out of the ear. So what's the sensory? Well, sure, hearing, but what else does your ear help with? Also equilibrium. So your hearing and your equilibrium are both being helped by the vestibulocochlear nerve, cranial nerve number 8. Cranial nerve number 9, which is going to be the glossopharyngeal nerve. The glossopharyngeal nerve is a mixed nerve. You can see how it's running down into the throat as well as the lower jaw. This is a mixed nerve. So again, sensory and motor. The sensory aspect is taste, touch, pressure, pain, temp, pretty much every sensation almost from your tongue. So if your tongue is feeling pressure because you bit down on it, looking at this nerve. If your tongue's feeling hot because you had some hot soup maybe, glossopharyngeal nerve. Any of the pain, so if you cut into it, slice it on something sharp, all glossopharyngeal. And then also, because it comes up here a little bit, into the outer ear. So any of that pain, touch, temp, any of that from the tongue and then also the outer ear is glossopharyngeal. The motor, salivation, so saliva, swallowing and gagging reflexes. You're saying, hold on, motor, that's output. Yes, because to secrete the saliva, that's a motor signal. Swallowing, to use the muscles in the throat, a motor output. And gagging, that's again, using the muscle in the throat to create that action. So all 3 of those actions are motor-based from the glossopharyngeal nerve. Cranial nerve number 10, the vagus nerve. Watch out for the spelling, it's V-A-G-U-S. Do not spell it like the city of Las Vegas. So this is vagus, V-A-G-U-S, the vagus nerve. Now, this vagus nerve will definitely come back up again as we talk more about the nervous system, peripheral, and AP2 as well. Because the vagus nerve has a huge innervation running down your entire torso. You'll notice here, we're talking the heart, lungs, liver, gallbladder, stomach, spleen, pancreas, liver, rectum, kidney, bladder. I mean, almost every organ from neck to waist is going to be found innervated, at least in part, by the vagus nerve. It's a very large nerve and a large part of the parasympathetic nervous system. So this is a mixed nerve. Sensory is ranging. We're talking a ton of different things here. Some examples. We're looking at taste, hunger, fullness, GI discomfort. So things right from the mouth all the way down through the abdominal cavity. And that's just some of the sensory functions. We're not going through all of them. Motor functions, things along the lines of swallowing, speech, decelerating the heart rate, so slowing the heart down. Well, it also slows down breathing rates too. But the idea here is there's a lot of different motor functions, there's a lot of sensory functions. So as you look at the different organs, yes, there's a lot of organs. We're not covering every single motor and every single sensory because it would just be too much. Get the idea though that the vagus nerve has a lot of innervation heading all throughout your entire torso. Another one to add in that is going to come back in AP2, bronchoconstriction. Bronchoconstriction is the shortening or the tightening of the airways. It reduces airflow through the bronchi. So that'll be brought up in the respiratory units. GI secretion and motility is another motor. This motor is helping the food pass through the intestines, out of the stomach, into the large intestines. We'll deal with that when we get to the GI unit or the actual digestive unit. So a lot with the vagus. Again, that's still not an extensive list. Cranial nerve number 11 is the accessory nerve, also known as the spinal accessory nerve. It's sometimes called the spinal accessory nerve because these rootlets, some of them will be coming off the actual spinal cord itself, not just the actual brainstem. So we have the accessory nerve. It is a motor nerve, and it's used for swallowing, think in the throat, swallowing, and muscle control of the shoulder movements, your neck, and portions of the head. So a lot of this area is being controlled by the spinal accessory or the accessory nerve, cranial nerve number 11. And cranial nerve number 12 is the hypoglossal nerve. Well, hypoglossal, H-Y-P-O below, glossal is tongue, so hypoglossal below the tongue. So that means this innervation you see is below your tongue, hypoglossal nerve. It is a motor output again. Dealing with speech, food movement, swallowing. Now, while the initial part of swallowing is a motor control conscious, once you swallow the back of the throat, the rest of the swallowing process is subconscious. It's just automatic. So the hypoglossal nerve is aiding in a lot of the conscious aspect, and then even can go into a little bit of the unconscious. But the hypoglossal nerve, primarily under the tongue, hypoglossal. All right, mnemonics. If these work for you, great. If they don't worry about them. There are a ton of different mnemonics out there. These are just two of the cleaner version of mnemonics at this point. So for the name of the nerves, you'll notice there's 12 words for each mnemonic. 12 cranial nerves, 12 words. Oh, once one takes the NAMI file, very good vacations are heavenly. The first letter of each one of those words matches up to cranial nerves 1 through 12. So we're starting O for olfactory, O for optic, O for oculomotor. So it goes through actual 1, 2, 3, 4, 5, all the way through. The type of nerve is trying to help remember, is it sensory, is it motor, or is it mixed? Now, obviously, motor and mixed are both M, so both is replacing mixed. So sensory, motor, or both sensory and motor. Some say marry money, but my brother says big brains matter more. Again, cranial nerves 1 through 12. First one is olfactory, some, S, sensory. Second one is optic, S, say, sensory. So it's going through and trying to match up each one of these. So again, a way of trying to remember which one is which, naming the first one, second one is the type, sensory, motor, or both. If they don't work, feel free to look up other ones online. If mnemonics aren't a thing, no worries. Whatever works for you is the key thing. So however you want to learn the 12 names, the associated numbers, are they sensory, motor, or mixed? And then what's some basic functionality and location for the different 12 cranial nerves? All right, 12 cranial nerves down. Time to move into the rest of the peripheral nervous system, more of the spinal nerves.